Greetings and welcome to Ask Dr. Danett, where I answer one women's wellness question from an Eastern medicine perspective. Today's question is prevention truly possible? Well, this is such a great question because it's very complicated. Sometimes when we think about preventive health, people think about it in all or nothing terms. But the reality is there are many factors that influence what happens in the body when faced with illness or imbalance. It depends on the state of a person's health already, their environment, stress levels, sleep, diet, genetics, emotional well-being, and so much more. Eastern medicine, which is what I'm a doctor of, is deeply rooted in the principles of prevention. Traditionally, prevention is considered to be the best approach to health and wellness. But I think one of the challenges today is that many of us never really get the opportunity to start from a zero baseline. There are things we encountered in the womb. There are tendencies we inherited from the state of our parents' health at the time we were conceived. There are experiences from childhood, chronic stress, environmental exposures, the effects of racism, sexism, other oppressions, and long-term stress on the body. All of these things can impact health. So when we talk about prevention, it's important that we understand that it's against a multi-layered background. There are people doing many things right who may still experience health challenges. Health is complex, and yet prevention is essential. And often prevention looks like paying attention to the things that we know help our bodies function and feel their best. Most of us already know some of the things that really make a difference for us personally. For instance, maybe you know you feel better when you consistently get enough sleep. Maybe your body feels better when you move regularly, drink enough water, reduce stress, or eat in a way that supports your energy and digestion. The challenge is that life gets busy. We tell ourselves we'll come back to those things later, but time is passing and the body's not thinking, oh, she'll come back to this later. The body is responding to what is happening right now and what support it is or is not receiving in the present moment. And I understand it's not always easy. We all have responsibilities, financial realities, stress, caregiving, work demands, and unexpected life circumstances that can make consistency difficult. But I still think it's really important to pay attention to your body and especially note the things that truly help improve your well-beings and the things that pull you further away from it. Even during difficult seasons, I think it's important to hold on to what you know are your foundational practices that support your health, even if sometimes you're only able to just focus on one. We all know the difference between when we are rested versus when our body needs more rest. We know the difference between how we feel when we're hydrated versus being dehydrated, nourished versus undernourished, and at ease versus overwhelmed. The body keeps track of all of it. I often say that the body is the best accountant. So while prevention may not guarantee perfect health, I do believe that supportive, proactive practices can significantly improve quality of life, resilience, vitality, and overall well-being, especially over time. Personally, I think it's best to have at least 1 to 3 non-negotiable things that no matter what, we commit to doing because we know they support our health and wellness. If you would like support with taking a more proactive approach to your health and wellness, I created a free resource called Dr. Danett's 10 Daily Longevity Tips. It includes simple practices rooted in Eastern medicine that can help support vitality, energy, and overall well-being. You can download it for free using the link in the description below. And as always, if you have a question that you would like answered in an upcoming episode of Ask Dr. Danett, please click on the link in the description below. Take good care, and as always, love being a woman.